Dr. Kalyani Gopal is the president of the Illinois Psychological Association, and she has been a good friend for many years and is a big supporter of Pushkin's authority. And so happy that she's here, and she's going to just talk for a minute about the excitement that she experiences with the psychology and with training and anything else you want to say about that. And the microphone.
I'm here at two levels. One is very personal, because Beth is a very dear friend of mine. We go back a long time. And I've been through all the trials and tribulations, over dinner, over drinks, and I'm so proud of her. And I know everyone's been clapping for her, but please give this very special clap, and please honor her, because I honor my dear friend. The Illinois Psychological Association owes a great debt to Beth and the work she has done for us. And like she stands on the shoulders of others, I stand on hers, and so do many others who follow me. I'm especially proud because I also have a daughter who's doing neuropsych at this point, finishing up her PhD. So for me, it's very, very personal as well, because one day I hope she becomes a prescribing psychologist. So Shefali, this is for you too. At a professional level, however, there's something that's very, very important. The reason why I support Beth and the RSP movement is because I work in the field of trauma and foster care a great deal. And when I was first starting out at work, the frustration for me was always the number of medications that our young children have. We had kids at 2 and 3 years old on risperidone and at least 7 other little medications. And these kids could barely handle themselves, never mind the multiple polyform that was going on with them. And they went from one foster home to another foster home. The therapists changed, the doctors changed, everyone changed. The depth of knowledge we have as psychologists is something unique to us in our profession. We have something that no one else has. We not only have knowledge and training and skills in psychotherapy and the theory and practice of psychology, you add RXP to it, that is power. That is power for each of our psychologists, and I commend you, and I commend Beth and all those who supported her, because these young children and teenagers will no longer have to switch from one doctor to another doctor because they do not understand trauma. They get diagnosed as bipolar, they get diagnosed as ADHD, there's multiple different diagnoses they have. So I thank you psychologists who have signed up for RSP, who become students, who are first wave of psychologists in Illinois, and I hope that you go to our rural areas especially and work with our rural population. Thank you so much.